Measles cases are on the rise nationwide, and with that, Bay Area health officials are urging people here make sure they are vaccinated. Darrow joins us now with more.
This isn't a sound the alarm moment. Bay Area health officials say the risk of exposure is low, but that doesn't mean that people shouldn't take steps to protect themselves from this incredibly contagious virus. Measles cases are on the rise across America. The CDC reports 64 cases across 17 states so far in 2024, which is more than the entirety of 2023. With that, Bay Area health officers came together Friday to urge people to make sure they're up to date with vaccinations. Dr. Susan Phillip is with the San Francisco Department of Public Health.
It is one of the most contagious viruses that we know of.
Symptoms include fever, cough, runny nose, red eyes, and they're typically followed by a characteristic rash.
In more rare cases, it can cause more severe symptoms, including pneumonia.
Earlier this month, Alameda County health officials warned of a possible measles exposure at Sons of Liberty, a restaurant in San Leandro. A few days prior, a confirmed case at the UC Davis Medical Center near Sacramento. Health officials say the majority of the documented cases nationwide are linked to international travel.
We don't have cases currently in San Francisco, but we have 3 major airports in the Bay Area. We know that San Francisco is an international city.
Among travelers at Oakland International Airport on Saturday, Scott Holmes was somewhat surprised to hear about measles, as he hasn't thought much about that virus in many years.
A disease from like 20 years ago.
He says while it's unnerving, he's not too worried about his kids.
Yeah, I mean, they've had their shots and everything, so not as concerned.
When Sarah LePay learned about the rise in cases,
I certainly checked to make sure that my children were up with their vaccines.
Nationwide, measles vaccination rates have fallen since 2019. Per CDC figures, around 93% of kindergartners were vaccinated last year. That's short of the CDC's 95% goal.
In the Bay Area, we do have a very highly immune and vaccinated population, which is great. If there are people who haven't vaccinated their kids that are over a year old or themselves, please do that. We want to make sure that kids have those vaccines at 1 year of age and then a second dose when they're a little bit older to protect them, and that's protection for life.
According to the CDC, the majority of the cases nationwide have been among kids 12 months and older who had not received the MMR vaccine.